Hello, everyone. Thank you for joining. We'll give it another 30 seconds or so before we get started. Looks like people are still coming in. Okay, it looks like some people have started to come in, but we'll go ahead and get started. We've lots to talk about. So thank you all for coming to this month's PKU University, where we'll be talking about Sephience, follow-up, and also have time for questions. So today we're going to hear first from Erika Vucko, who's a family nurse practitioner at Lurie Children's, and she'll be explaining more about Sephience and more information. And then we have Christina from PTC to also help answer some questions. So as a reminder, there's a Q&A box down below. Please feel free to put in your questions as you have them, and we'll take time for questions at the very end. So we'll answer them later, but feel free to add them as they come. So I'll now turn it over to Erika to start the presentation.
Great. Thank you, Kelsey. I am thrilled to be here today, and it's wonderful to see so many people from the community joining. As advertised, today's discussion is really all about Sephience. What is this new medication? How does it work? And what can PKU patients and families expect as it relates to management with this product? These are disclosures, so I am being compensated on behalf of PTC for my participation in today's program. A really important point is that the intent of today's discussion is really meant to be education, a way to educate the community about this new potential therapeutic for patients with PKU. And while there can be some similarities in the PKU journey, we do know that each patient is unique. So this is not meant to serve as medical advice, but I definitely encourage you, if you haven't already, grab a pen and paper or pull out the notes app in your phone, write down questions as they come up, and those would be best to be directed at your individual clinics because your providers and your healthcare team are the ones that know you or your loved one best and can best answer those questions. If you have additional thoughts around the medication or want to read more about it, you can find the full prescribing information for Sephience on the website that is listed here on your screen, www.sephience.com. Before we dive into a lot of the content in today's program, I wanted to spend just a few minutes going through some important safety information that really any patient or family should know when considering if Sephience is the right tool for you. So first, I want to start with the indication. And as a clinician, that's what we use to guide us in who is this potential therapeutic appropriate for. And per the label, Sephience is a prescription medication that is meant to be used to lower blood Phe levels in adults and children 1 month of age and older who have PKU. And it is meant to be used in conjunction with a Phe-restricted diet. Now, in terms of side effects, some of the more serious side effects that it's important for patients to be aware of. One is the risk of increased bleeding. So there were a few patients in the clinical trial who did report symptoms that are consistent with increased bleeding. And so we want to educate any of our patients who are considering Sephience to just be aware to monitor for signs of easy bruising, potentially heavier menstrual cycles, or any increased bleeding. Another concern that we want patients to be aware of is the potential for blood Phe levels to become too low, or what we call hypophe. And this is when blood Phe levels are below that normal lower limit of the reference range. Now, some of the more common side effects that we're seeing in the clinical trial that we definitely educate and talk to patients about are with starting Sephience, you may notice upset stomach, diarrhea, headache. You can see a discoloration of stools, and that's just because of how bright the medication is. And throat pain was another one reported in the clinical trials. As with any side effects when starting a new medication, we just want patients to be really attuned to their body and report anything that's of concern to your healthcare provider so that they can best guide next steps. Other important information that we want to talk to healthcare providers about before starting a new medication is any other medical conditions that a patient may be navigating. And that's important because that helps discern whether is this related to that other health condition that a patient has, or could this be related to the new medication? Definitely important to let your provider know if you are considering becoming pregnant, or if you are currently pregnant, or if you are breastfeeding or considering breastfeeding. And in both of those cases, it really comes down to just not having data available to determine if there is any potential harm to an unborn baby if exposed to Sephience, or whether or not Sephience passes into breast milk. As is the case with starting any new medication, it's really important that you tell your healthcare provider about any other medications that you're taking. That includes any prescribed medications or any medications that you take routinely over the counter, any vitamins, or any supplements. And basically, the rationale for that, or the reason that we want to know, is basically because of interactions. We know that there's a potential that some other medications, vitamin supplements could impact how well Sephience works. And in that same way, there are other medications where Sephience could impact how well these other medications work. We definitely also want to know in specific scenarios about any medication that contains levodopa, an antifolate medication, any medication someone could be taking to treat erectile dysfunction. And then, of course, you want to let your provider know if you're on any other medication that is also meant to lower blood Phe levels. In terms of how do I take or give Sephience if I'm a parent of a young child, and really we just want to follow the instructions that your healthcare provider tells you. Hopefully your clinic will provide very detailed outlined steps of how to prepare the medication and how you give it. But just in general, the dose that your provider is going to prescribe is going to be based on the patient's age. So dosing is a little bit different for our most youngest patients. And it's also based on weight. And you will take the medication one time each day. It's meant to be taken with food. And we actually do recommend that patients take a little bit more food after the dose is taken as well. And really, that is because the food will help the absorption of the medication itself. In terms of how to prepare the medication, I'll talk about that in a lot greater detail later on in the presentation, but just as a brief high-level overview. For doses that are less than 1,000 milligrams, we recommend that patients mix the powder in water or apple juice. And then once mixed, you'll drink that. For doses that are 1,000 milligrams or higher, patients can mix it in those same two things, or you can mix it in soft foods like a strawberry jam or applesauce. If we miss doses, we know life happens, people get busy. This is a medication that's meant to be taken every single day. But if a patient does miss a dose, you just want to take the medication as soon as you remember, with the exception of not wanting to take two in one day. So as soon as you remember, just go ahead and get back on your normal dosing schedule. Obviously, with starting a new medication, strong ties with your clinic in terms of communication and follow-up are important. We want to know how our patients are tolerating the medication. Are they able to take it consistently? And most importantly, we want to see how blood Phe responds. And so, of course, each clinic is going to have their own recommended follow-up, but making sure that we're keeping those lines of communication open is really important. And that blood Phe monitoring is critical in helping us determine how well a patient is responding. And furthermore, I know a big interest for many patients is how can a medication change the diet that I'm prescribed? Again, those blood Phe levels are going to be critical in allowing us to make adjustments in a safe way. And there is a potential to adjust diet, though that's going to be very individualized. So again, making sure that you're connecting with your clinic and not making any changes without your dietitian guiding you. So now that we've spent a few minutes going over some of that important safety information that all patients and families should know, I want to give you now a high-level overview of the topics that we're going to be discussing in the remainder of today's program. We'll start with sort of setting the stage. This is a medication for PKU, so we want to make sure that everyone listening has a good understanding of what PKU is. We'll talk about how Sephience works in patients with PKU and how prepare patients for what you can expect if Sephience is added to your treatment plan. We'll touch again on some of that safety information because it's so important for patients to know. And then we'll talk about how can someone get started if they're interested and what supports are available for those who are prescribed this medication. So, what is PKU? I know that I'm likely talking to an audience of experts on this, but in case there's any newly diagnosed families in the audience, and also we know that sometimes it's nice just to have the refresher, we'll start with just reviewing that PKU is a genetic condition that impairs the body's ability to break down a piece of protein, an amino acid called phenylalanine, and convert that into another amino acid called tyrosine. Now, because the body's ability to convert Phe is affected, it's not working properly, what happens is that phenylalanine begins to build up. Now, even though it's a natural part of protein and something that our body is used to seeing, at high levels, it becomes toxic, specifically to our brain. And so, if a patient goes untreated, they are at risk for developing serious complications, especially neurologically. Now, thankfully, we have newborn screening that has been around for many decades, and that allows us to identify babies who are affected with PKU very early on in life. And that is what allows us to initiate treatment very early on in life. And the mainstay of PKU treatment, that cornerstone of treatment for the last several decades, has been dietary intervention. And so, what we typically do is we restrict the amount of natural or intact protein a patient is consuming each day. And then we replace that gap of total protein that all patients need with special medical food and formula that has little to no Phe in it. So, most patients with PKU that are prescribed and managed on diet are avoiding high protein foods like meat, eggs, dairy, nuts. Now, the reason that we do that, again, is to lower those blood Phe levels because we know when blood Phe levels are lowered and kept in a safe range, we can have positive outcomes and avoid a lot of those serious complications that I alluded to earlier in the presentation. So, what are the safe levels when it comes to PKU? Well, we have the American College of Medical Genetics and Genomics that has guidelines published for the diagnosis and management of PKU, and these were actually just updated in 2023. And the recommendation is that patients with PKU maintain their blood Phe levels at or below 360 micromoles per liter or at below 6 milligrams per deciliter throughout the lifespan. So for all ages, we want to see levels below that 360. And that recommendation really comes from a lot of data and studies in the literature that note that when levels are kept in this recommended range, we see improvements in IQ and we see significant strides in terms of cognition. So, what are the tools available to help achieve those blood levels? We are excited, of course, to review that there is now a new tool when it comes to helping patients achieve this blood Phe level. The latest is Sephience, which we're talking about today, which was FDA approved at the end of July this year. And as I mentioned earlier, it's indicated for the treatment of PKU to lower blood Phe levels in adults and children 1 month of age and older, of course, in conjunction with a Phe restricted diet. So, how does this medicine work? Well, Sephience is a natural precursor of BH4, and BH4 is a cofactor to the PKU enzyme. And this cofactor essentially helps drive enzyme activity. So, when a patient takes Sephience, they are increasing the body's natural process of producing BH4. The more cofactor that's available, the more enzyme activity we're getting out of a patient's enzyme, the more active that enzyme is, the more Phe is being processed, and the lower the blood levels become. And so now that we know how it works, what can a patient expect in terms of what it actually means clinically to start on this medication? And I'll say that when medications are newly approved, where we go to get that information of how do we sort of shape expectations and talk to our patients and families about what to expect with this new medication that hasn't yet been used in the clinical space. And we really look to the clinical trial program and the publications that come out from that data. And so Sephience was studied in Affinity, which was a two-part clinical trial that had patients ages 1 up to 61 years old, of course, all patients with PKU. So, in this first part of the affinity trial, which often is referred to as that response finding part, there were 156 patients who received their age and weight specific dose of Sephience, and they maintained on the medication once a day for 2 weeks. And what you see here at the bottom left-hand side of your screen and that purple circle is that 66% of those 156 patients had at least a 30% or more reduction in blood Phe after just 2 weeks on Sephience. Then we move into part 2 of the clinical trial, and this part of the trial had 98 patients coming from that 156, and of the 98 patients, these were patients who were 2 years of age and older, and they were patients who had at least that 30% reduction of Phe or more. In part 2, those 98 patients were randomized to either receive placebo for 6 weeks or they were randomized to receive Sephience for 6 weeks. And what we're seeing at the bottom right-hand side of the screen and that purple circle is that for those patients, those 98 patients that got randomized to Sephience for 6 weeks, that at the end of 6 weeks, there was a 63% reduction in their blood Phe. Now, another really important question that we have as clinicians who manage patients with PKU, but also as the PKU community, whenever a new medication is coming to market, is what does this mean for the different types of PKU and potentially those buckets that may have some greater unmet needs? And so we're thinking about our more classical patients. And so in the affinity trial, there were classical patients, and there were also patients who were deemed non BH4 responders based on treatments in the past. And so, just to help set the stage, the definition in the clinical trial for a classical patient was any patient who had at least one lifetime blood Phe greater than 1200 micromoles per liter or greater than 20 milligrams per deciliter. And so you'll see here on the left-hand side is our bucket of classical patients that were randomized to Sephience. Those patients, there was a 69% reduction in blood Phe at that 6-week time point. And on the right-hand side of the screen, we see our bucket of our non-BH4 responders, and there was a 54% reduction in blood Phe for those who were randomized to Sephience at 6 weeks. Really, I think the messaging here, the takeaway for patients and families and even clinicians is that this could be a potential therapeutic for a patient with PKU, regardless of where they fall in terms of severity of PKU or what their prior treatment experience is. So, definitely worth having a conversation with your clinic about what Sephience could mean for you. Now, we talked about the percentage change in Phe, right? We talked about that reduction in the classical patients, their Phe reduced 69%. Well, what does that mean? Where did patients actually land? Because we do have guidelines, we have a target treatment range. And I think what we all want to know is that's great that Phe was lowered. We know the lower the better. But how many of those patients were actually able to get within the guideline range? And what we have here is that data. So 84% of participants who took Sephience in the Affinity trial were able to achieve blood Phe levels at or below the target guideline. So that's, again, below that 360 or below that 6. What's also really interesting is the percentage of patients that were able to achieve the physiologic range of Phi. So when we talk about the physiologic range of Phi, that's where blood Phi typically sits in individuals who do not have PKU. And 22% of patients who were treated with Sephience in Affinity were able to achieve blood Phi levels in that physiologic range. And remember, patients were randomized to Sephience or placebo. And so while 22% of patients on Sephience were able to reach that physiologic range, there were no patients who were on placebo who were able to achieve that. And I think we all can understand that because that's a really hard goal to achieve with standard therapies. So another important piece of data from the trial portfolio that I want to touch on, because I know, again, important talking point for the community is how does this new medication change potentially the dietary recommendations that a clinic may be giving a patient. And so following the Affinity clinical trial, the extension study was, of course, looking at what is the long-term safety and efficacy of this new medication, but it also had the goal of answering the question around, can natural protein be changed or modified while a patient is on this medication? And so in the extension study, which is ongoing, but there was a data cut last September. So that data cut last September is the data that I'm going to be sharing in the next slide. Included a total of 169 patients with PKU, and the ages ranged from 2 months of age up to 55 years of age. But the median, that middle number, was 14 years old. So what that tells us is there was a decent patient population that were pediatric in this extension study. And when patients entered into this study, they were divided into two groups. So the Phi level was taken while these patients were on Sephience. And for those patients who had a blood Phi level at or above 360, which remember, that's our upper limit of treatment, those patients just continued on Sephience and maintained their baseline dietary management. The second bucket were patients who had blood Phi levels that were below 360 or below that 6. And those patients underwent a 26-week dietary assessment where natural protein was slowly increased while closely monitoring blood Phi levels. And from that 169 patient pool, there were about 102 patients that were in that bucket that underwent the 26-week dietary assessment. And so this is the outcome data, again, as of September 2024. And so after 26 weeks of treatment, 97% of patients in that bucket were able to increase their dietary Phi intake. About 2/3 or 70% were able to meet their daily recommended protein needs. And so a way to sort of conceptualize what does that mean for someone is if you had an individual who weighed 110 pounds, meeting their recommended protein needs would be equivalent to tolerating about 60 grams of natural protein a day after 26 weeks of treatment. Now, I do want to just make note that there are some limitations that we have to keep in mind when we're looking at this data. One of which it's open label, so that means that the researcher who's overseeing the study at a particular site and the participants knew what treatment was being given. Also, patients were reporting their own intake, and so it may not always have been exact, and there were some study records that were incomplete. So important to keep that in mind when looking at this data. Again, as I mentioned in the extension study, part of what you're looking at is long-term safety. And does the long-term safety match what we saw in that initial affinity trial? And it did. The most common side effects were all the things that I mentioned earlier: headache, upset stomach, diarrhea, throat pain, and again, that stool discoloration just based on the color of the medication. And again, we can see low blood Phi levels or hypophi when patients are managed with this medication. Again, just that call out of how important it is to communicate with your clinical team Really, when you're experiencing any issues as it relates to your health, but especially when you're starting a new treatment, if you happen to notice anything different in your body or how you're feeling, there are a lot of different things we can do as clinicians with your medication. We can pause it, we can dose adjust, and potentially even discontinue based on what a patient's reporting. Also, when it comes to those low Phe levels, we may need to adjust diet to bring those levels back up into at least the physiologic range. So again, can't reiterate enough and put in a plug about how important the communication is, because we can only support with what we know. So making sure that you're keeping your clinical team aware of if you're experiencing any of these side effects. We also don't want any of our patients to be in discomfort. So if there's things we can tweak, we want to be able to do that. So what's important to know about taking Sephience? I've reviewed a lot of this already, but just to go through it in a little bit more detail, you do take Sephience once daily, again with food. I talk to my patients. Obviously, we want patients to take a medication at a time of day when they feel like they can really be successful at taking it consistently. However, I've talked to some of my patients. If you're somebody who wakes up first thing in the morning and just cannot eat breakfast, then maybe Sephience is best taken for this particular patient at dinner time, a time of day where they are more reliably getting in a substantial amount of food. You always want to take a little bit of food after that dose is consumed, again, just to help the body absorb it and get as much benefit as possible. The dose is based on age and weight, so just bearing in mind for parents of little ones, as they grow, as they age, their dose will change. For our adults, sometimes there are weight fluctuations, so your dose may change in those cases. So it tends to be a little bit more stable dosing for adults. And of course, we see in our pediatric patients who are consistently growing. In terms of how the medication comes, this oral powder packets, and we have two different strengths available for Sephience. So there are 250 milligram packets and 1,000 milligram packets. So your clinician will come up with the dose for you or for your loved one and tell you X number of packets are to be opened each day, X number of the 1,000 milligram packets, and a certain number of the 250. So you will be provided clear instructions of how much of each packet you should be opening each day when preparing your dose. And again, as I mentioned earlier, you can mix the oral powder with water or apple juice. If the dose is 1,000 milligrams or higher, then you have the added options of soft foods like a strawberry jam or applesauce. Taking it down to a little bit more granular detail and the actual mixing. So when you're going to prepare your dose, you want to get all the packets ready, out and available, open those up, and you will empty those into your preferred source, whether that's a liquid or if it's a higher dose and you want to use a soft food. You will dump the powder into whatever you're choosing to mix it with. Then you want to mix until combined. Now, if you're mixing your medication into a liquid, you want to mix it vigorously for 30 seconds. If you happen to be mixing a higher dose into an applesauce or the strawberry jam, you want to mix for at least 60 seconds. Don't be surprised if you can still see the medication. It's not really meant to completely dissolve because it's a suspension. However, you do want to make sure that it's mixed thoroughly. We also then want to administer the dose for our little ones who maybe have really small doses that they're being prescribed. You can use an oral syringe to really precisely pull up the medication to that right dose. And then we want to make sure that we're rinsing. So if you're drinking your medication out of a cup or you're administering the medication in a syringe to a child, just making sure that you're pulling up maybe some water after you administer the dose in the syringe, or you're filling your cup with water, kind of mixing it around and then rinsing. And that's because we want to make sure that we're getting any residual that could be left in the syringe or left in the cup so that someone's truly getting their full dose. Something that's interesting with Sephience is that while we do recommend that after mixing, you take the full dose right away, it is stable and okay to be left at room temperature for up to 6 hours. So while most patients are just going to mix it and take it right away, I definitely have younger patients where I've had parents talk about challenges with them finishing the dose and kind of staying on top of them, and the school bus is coming or they got to get out the door to get to school. And so I think it's nice that there could be a little less pressure in getting it all in right there. It is safe up to 6 hours at room temp, and it actually can be stored in the fridge for up to 24 hours. So in review, we are all excited, clinics and the community alike, I'm sure, that we now have a new tool available, another option to offer our patients. Sephience is a medication that is shown to reduce blood Phe levels across all ages and in different types of PKU, with about 84% of patients reaching guideline target Phe levels after 6 weeks of treatment. Has a proven safety profile, and it is once daily dosing by mouth, which allows for a little bit ease of administration. I thank everyone for your attention during my portion of today's presentation. And of course, as Kelsey mentioned, there's a Q&A section at the end. But right now I'm going to transition this to Christina to take us through some of the supports that are available through PTC.
Thanks, Erika. Hi, everyone. My name is Christina, and I'm the Senior Manager for the PTC Cares Case Managers. Over the next couple of slides, I'll be sharing resources provided by PTC Therapeutics. To kick things off, we have our incredible patient engagement team that's displayed on your screen. Their focus is on providing resources and support to individuals living with PKU and their families throughout their rare disease journey. This team has a broad background from metabolic dietitians, child and life public health specialists to rare disease patients themselves and caregivers. We also have 2 team members who are fluent in Spanish. This team works with local and national patient advocacy groups like NPKUA. They are here to support and empower you through education. They are Frank, Melissa, Summer, Anne, Emily, Natalie, and our Spanish speakers, Aurora and Karina. Next slide, please, Erika. Thank you. Next up, we have PTC Cares. And although we don't have their pictures displayed here, I did want to share a little bit about this team. We have 9 case managers in total, and they are Rick, Peter, Rachel, Courtney, Kenneth, Sarah, and our newest additions, Lisette, Fran, and Bert. Together, they hold a combined 80 years of case management experience. We also have 3 Spanish speakers as well, and they are Rick, Sarah, and Lisette. Through PTC Cares, individuals will receive a single point of contact, assistance with insurance access through the prior authorization and appeals process, as well as monthly refill assistance. Additionally, depending on the situation, individuals may qualify for one of our 3 programs displayed on your screen. Our first program is copay assistance through our copay card, which means individuals who qualify will pay little to nothing for their Sephience medication. Next is our bridge program. This program helps patients who have already started on Sephience but lose their insurance coverage. They'll receive a temporary limited supply of medication at no cost while their new insurance benefits are being verified. Our third program is our Patient Assistance Program, or PAP, which helps patients who do not have any active insurance receive Sephience at no cost if they qualify. Next slide, please. Thank you. So once a decision is made by you and your healthcare provider, enrolling into PTC Cares is easy. Your healthcare team can connect you with the PTC Cares team directly. You can visit the Sephience website, call the team directly, or you can scan the QR code that'll be displayed on the next slide. This team is very responsive and focused on making this process simple. They want you to know that you're not in this journey alone. Thank you so much for listening, and now I'm going to turn things over to Kelsey with NPKUA.
Great. Well, thank you both, Erika and Christina, for that presentation. And now we'll get into the Q&A portion. As a reminder, continue to put your questions in the Q&A box down below, but we already have some, so we'll go ahead and get started. So the first question will be directed to Erika. We've gotten some questions from individuals asking whether Sephience was tested on their specific either variant or mutation. Is there anything you can share on that?
Yes. So actually, genetic information was collected for patients that were enrolled in the affinity trial. So that is information that is that has been collected, but it just hasn't been made available yet. So it hasn't been published. So I think my recommendation is the best thing for a patient to do is, again, to talk directly with your healthcare clinician. I know for some of our older patients, before genetic testing was a routine part of that diagnostic workup, there may not be that information available, but there's a lot of information that we do have for patients about their specific PKU that I think can help guide the conversation about what someone can expect when starting Sephience.
Great, thank you. And I will make a quick plug if anyone ever has issues getting coverage for their genetic testing. NPKUA does have a program to help support people for that. So if you're ever interested in that, happy to help facilitate if you reach out to us. Okay, so our next question, also for Erika, related to how many or the percentage of participants in that affinity trial that you mentioned had classical PKU, and then also if there was additional data related to either that group and or to the BH4 non-responders.
Yes. So the company, when they designed the clinical trial program, had capped the total number of participants that are classical or non-BH4 responders at 20%. So it is a smaller subset of the total 156 that were enrolled initially in part one. And remember, not all 156 patients moved to part two. And that's because some patients didn't meet that criteria to enter part two, which was at least a 15% or more change in fee. I will say when we think back to that part two data, remember I had talked about classical patients having a 69% reduction in blood fee. That is data from 6 patients. There were 9 other classical patients based on the definition of the trial who were also in that bucket, but they were randomized to placebo. So that 69% reduction in fee is based off of data of 6 classical patients. And then when we think about the non-BH4 responder group, that was a total of 23 participants that were non-BH4 responders. And I believe it was 13 of the 23 that were randomized to Sephience and 10 that were randomized to placebo. So again, I believe it was a 54% reduction in blood fee in part two for that group. That's going to be reflective of those 13 individuals. So again, I think it's important that it just opens a door for that conversation, regardless of your treatment history or the type of PKU you have. Again, it doesn't mean that those will be the responses for every single patient, but it opens the door for conversation and a potential regardless of your history or type of PKU.
Great, thank you. And the next question is actually for Christina. So we've gotten some questions related to the cost of Sephience, with one person also noting that their insurance will not cover the medication. Is there anything you can share about that and how people would navigate that problem?
Yeah. So as far as costs related to Sephience, if your insurance is covering the medication, we do have our copay card that I briefly discussed a couple of slides back. So if you qualify, and that would be just maintaining a commercial insurance, then you would pay little to nothing for your Sephience medication. For those that have coverage through Medicare, Medicaid, or TRICARE, there are also foundational assistance programs that the specialty pharmacy can assist you with navigating to and seeing if you qualify for assistance through them. Additionally, to answer the second part of that question, if you have no insurance coverage, if you don't have any active insurance, then we do have our patient assistance program. But if you do have insurance and the insurance is just stating that it's not covered, if you have visited your doctor's office and have been prescribed Sephience, our case management team is great troubleshooters. They're very strategic thinkers. And so based on the denial letter, they'll review it and they'll come up with a plan. And it'll be varied on an individual basis because every denial is different. But there are a few options that we've been exploring that we've seen success with. So I would just, if you haven't already been prescribed Sephience, I would take that as the first step. And then the second step would just to have a conversation with your case manager.
Great, thank you. And then another question back to Erika. You went into a little bit of detail about what makes Sephience distinct. Is there anything more that you can share about that or really how it works?
Yes, absolutely. So again, I will say that when it comes to Sephience, there's sort of two proposed mechanisms of action. The first one we know is that Sephience, which contains sepiapterin or sepiapterin, and that is going to, something that we all have, and it's going to enter into a natural pathway in the body that normally produces BH4. So patients take Sephience, and when they take it, it's that sepiapterin is going to enter into that natural pathway and increase or rev up the production of BH4. So now patients will have more intracellular BH4 available to help rev up whatever natural enzyme activity a patient is making. The second mechanism, which is proposed, so it's based off of medical literature and hasn't necessarily been proven, is that Sephience actually binds directly to the PAH enzyme. So one thing that I explain to patients is that there are variants in the genetic information that impact how the enzyme is made. And one of the ways that its impact is what we call this misfolding. And so you can sort of think of it as a misshapen or unstable enzyme. And so what happens is the proposed mechanism is that Sephience also, some of it will go into that pathway to produce BH4, but some of that Sephience will directly bind to the PAH enzyme, restoring some of that enzyme structure, which increases stability. And the more stable the enzyme is, the better active and the more efficient it is. And again, both of those mechanisms are working to drive increased breakdown or conversion of Phe into tyrosine, which lowers the blood Phe.
Great, thank you. And then also, Erica, for you, one individual is wondering about the increased risk of bleeding that you talked about. Can you explain that a little bit more?
Yes, absolutely. I know this is something I speak to all my patients about because I know it can sound really scary. There was one person in the trial who experienced non-life-threatening bruising and prolonged bleeding, and it resolved once the treatment was discontinued. And so it's because of that particular patient that warning is on the label and is a conversation that we have to have with patients. I will say from the medical information that I was able to obtain as it relates to this specific case, that there was no abnormalities in the clotting factors or the different markers we look at on a patient's ability to stop bleeding. So I think that provides me as a clinician with a little bit of assurance. But again, we need to be aware of this. We need to educate patients about that. And we need to have patients know what signs and symptoms to look out for so that we can adjust dosing if needed.
Great. Well, thank you for that explanation. And this is going to go back to Christina. We had one individual note that they need a QR code to access the PTC Cares program that you mentioned from your slide. So
Mhm.
how can people access PTC Cares after this
Sure.
meeting?
Sure, there's a couple of different ways. So the first is you can visit the Sephience website. A second is we actually have a PTC Cares website. And so you can go to that at the top right hand of the screen. You'll see the different medications that PTC has and the different disease states. You would just toggle over to PKU. And then you can actually, there is a section under PKU of it says case managers. And if you enter in the zip code of your physician that would be prescribing the medication Sephience, a picture of your case manager will actually populate along with a little blurb. So it's good, adds kind of personal touch to that.
Great, thank you. And this next question is back to Erica. So what types of food should individuals be taking Sephience with? One person specifically asked about fat-containing foods specifically.
So the prescribing information doesn't necessarily say how much food to take with Sephience, just that it should be taken with food. And we know that from the clinical trial, the BH4 exposure, so that's sort of the end goal, right? Is how much BH4 this medication is helping the body produce, were higher when patients took the medication with a higher fat, higher calorie meal. So that's a very specific definition per the FDA as it relates to trials. So I would, they say anywhere from, greater than 30% of the calories are coming from fat. It's actually much higher for that specific definition. But I would speak with your individual dietitian to see if they have they can kind of guide that, just because again, everyone's dietary needs and where someone's sitting at with their baseline intake and what foods are available to them is going to be different patient to patient. So your dietitian will definitely be able to guide you in terms of what foods you could potentially do. But I just tell my patients trying to think of something that is a little bit more substantial, has higher calories, and a little bit higher fat intake is a good goal to have to just help to optimize that absorption and efficacy.
And as a bit of a follow-up to that, some people are asking about the consistency of Sephience. So can you explain more why it doesn't fully dissolve?
Sure. It's a suspension. And so, like I had mentioned earlier, it's not really expected or meant to fully dissolve when you mix it. And so that's, yeah, it's just, that's how the medication is made. So it's intentionally not meant to fully dissolve prior to consuming.
Okay, great. And then another question for you, Erica. One individual is asking how much someone can expect their protein intake to go up. So, whether they may be able to eat meat or dairy or other things high in protein. So, can you explain a little bit more about that?
Yes, I think that's a great question and likely one that many patients have. Unfortunately, it's not one that I can readily answer just because um, everyone's baseline is different, from one patient to the next. So we know from the data that 97% of patients who did respond to Sephience were able to shift how much intact protein they were being prescribed. But and while 70% were able to go to what we call the DRI, or that daily recommended intake, it's hard for me to extrapolate that because what I don't have in that is where were those patients at baseline. So it's very different for someone who is maybe prescribed 5 grams of natural protein a day to go to 60 grams in that example of a 110-pound person versus someone who maybe came into the trial already prescribed 30 grams of natural protein a day and then reaching it to 60. So I don't have enough contextual data to make, a good estimate of individual to individual what they can expect. But I think that likely with some of this information and talking with your healthcare team who does know all your personal information of what you're prescribed, where you fall sort of in that the spectrum of PKU, will hopefully be able to give you some guidance as to what you can expect when it comes to potential adjustments to your protein intake.
Yeah. And as a follow-up to that, do you think individuals, or can you provide more information about if individuals should expect to continue needing to take formula?
I think that again is an individual question, right? So we don't eliminate formula unless someone is able to safely consume the daily recommended intake of protein while maintaining safe blood Phe levels. So again, I had talked about in the very beginning part of the presentation when reviewing PKU and the dietary intervention is that all patients, whether you have PKU or not, need a total amount of protein each day. And that total amount changes based on age, activity level, and different factors. But it's just how much of that total bucket is coming from natural sources. And that's based on, are you on a medication? Where is your natural enzyme activity? There's a lot of different variables. So I would just say the way I'm framing it with my patients is we're starting this medication. Let's see how your Phe levels respond. My first course of action is always going to be to increase intact protein. And I don't want you to think necessarily about formula because that is providing a really critical source of nutrition and helping with Phe control. And it's only after we make certain strides in increasing intact protein do we feel comfortable peeling away medical formula. Now, that doesn't mean it won't happen. There were patients in the trial that did eliminate medical formula, but it's too individualized of a situation to be able to answer without having all the details on your particular case. So definitely recommend talking with your healthcare team about that.
Yes, that makes sense. And I know you talked a little bit about this during the presentation, but what happens if a person or a child doesn't take their dose all at once? Can they store Sephience, or how does that work?
Yep. So as I mentioned, the medication once mixed or prepared is good at room temperature for up to 6 hours. So it's safe and you'll still get full efficacy if as long as it's consumed within that 6 hour time point if it's left out. However, if you could also store it, that mixed dose in the fridge and it's good and still will remain efficacious for a patient for up to 24 hours. We just recommend that, of course, when you bring it out of the fridge, you'll want to mix it up again so that it is a little bit, you're smoothing out that texture.
Great, thank you for that answer. And I think I don't see any more questions coming in on my end. Anything else, Christina or Erica, you want to share before we close out?
No, I just thank you for the opportunity to speak to the community today. I always enjoy being able to share knowledge and educate. And I thank everyone for the fabulous questions. And I hope that everyone was able to at least leave with one piece of knowledge that maybe you didn't have at the start of this.
Great,
Yes,
well,
thank
thank
you for
you.
everyone.
And this will also be recorded, so we know it was a lot of information that we covered today. So we will be uploading this to our YouTube page. So if you ever want to go back and listen or get more information, feel free to do that. But thank you all so much for joining today, and hope you have a great rest of your day.